Duke's Dentistry et al. Proudly presents Certificate in Medical Emergencies for Dental Practitioners, together with Dr. ChetTrivedy. Hello, Dr. Trivedi.
Good morning.
Would you be so friendly as to introduce us to your great course?
Certainly. Hi, my name is Dr. ChetTrivedy, and a big welcome to the Certificate in Medical Emergencies. Whatever field of dentistry you practice, there's always the possibility that one of your patients may become unwell in the dental chair, and they'll be relying upon you to provide them with life-saving treatment. Over the years, we have learnt a lot from the safety from the aviation industry. Flight staff spend a huge amount of time on simulators practicing emergency procedures as if there is an emergency during a flight. It can make all the difference. Imagine you're going on holiday and you've just taken off and you hear one of the pilots say over the tannoy, "I hope we didn't need our emergency landing protocol today. It's been a while since I've practiced this. Enjoy your flight, folks." Our patients expect nothing different. They put their faith completely in our hands. They expect that if they become ill, you will know exactly what to do. Imagine it's 4:30 p.m. on a Friday afternoon. You're about to start your procedure when the patient turns blue and stops breathing. Could be a reality. What are you going to do? This is a real situation and something you should be prepared to deal with in your practice. This is why we're offering you the Certificate in Medical Emergencies, which will take you through what to do in terms of an emergency. A little bit about me. I qualified as a dentist from the University of Liverpool in the UK in 1993. In those days, it was a good football team, and I believe in their motto, "You will never walk alone." In 1996, I obtained my fellowship in dental surgery from the Royal College of Surgeons in England, and then I went back to medical school at Guy's, King's and St Thomas's and got my medical degree in 2003. In 2004, I went back and got my PhD in head and neck cancer from the King's College London. Following that, following my medical qualification, I have pursued a career in emergency medicine, and currently I'm working as a lecturer in emergency medicine as well as a practitioner at a local accident emergency department in the West Midlands. I've been qualified as a registered dentist for 20 years and a registered medical practitioner for over 10. I've got a big interest in academia, and I've written 2 textbooks on emergency medicine, and I teach across the world on medical emergencies. I've spent a lot of time teaching dentists about medical emergencies and as well as doctors about dental emergencies. Okay, so what is the MEDS course all about? In essence, it's an online certificate in the management of medical emergencies. The course involves online lectures, tutorials over a period of 10 months. Each month we will spend approximately 1 hour as a lecture going over the basic concepts, theory and the practical aspects of managing a medical emergencies, as well as an hour's worth of tutorials each month going over some of the more finer aspects of each emergency. We will use real case scenarios and cover the main medical emergencies that you are likely to come across as a dental practitioner. We will also have online MCQ assessments to help identify some of the more learning objectives. Now the modules. Let's go through each module very quickly. The first module is actually an overview of medical emergencies in terms of obligations, expectations, and responsibilities. Now, as this is an online program and you may be in a country different from the UK, we've got to make sure that you are safe and you are competent and you understand what your expectations and responsibilities are in terms of managing an emergency. Now, from module 2, we will talk about the A, B, and C of medical emergencies in terms of airway, breathing, and circulation. And then from module 3 onwards, we will talk about each of the components in detail. We will talk about the airway and how to manage the airway and recognize airway problems, followed by breathing, circulation, and neurology. We will follow that by basic life support, which is very important for all practitioners in adults as well as children. And then we will talk about the use of automatic external defibrillation, or AEDs. These are known to save hundreds and thousands of lives across the world, and it's very important that as a dental practitioner that you're aware of how an AED works and how you could use it in practice. No emergency course could be complete without discussing the emergency drugs and how to use them safely. And then from 11 to 20, we'll talk about specific conditions, the pathology, the physiology, how they present, and most importantly, how you can prevent emergencies from occurring in the first place. It's very useful to know how to manage anaphylaxis, but how can you prevent it? How can you prevent an acute asthma attack, and how can you prevent a heart attack? So we will discuss the conditions which are important for you as a dental practitioner, and also how to prevent them. So from modules 11 to 16, we will talk about specific conditions. Now, one of the things I think is very important, even in medical emergencies or whatever you do, is communication and teamwork. This is something that we don't use enough of in clinical practice, but we're going to talk about how you communicate with patients to get the most out of them in terms of a medical emergency, and also how do you work with the rest of your team, how do you work with your dental nurses, the receptionists, and also how do you discuss with doctors, how do you discuss with the paramedic team to make sure that you give the right information across. Module 18 is really exciting because we'll talk about practical procedures on things that you can do to maximize your outcome in the medical emergencies. And then module 19, a lot of you may not be familiar, but there is an assessment called an OSCE, which is the Objective Structured Clinical Examination. This basically, we use live case scenarios, and we'll actually work through scenarios to see how you would respond in an emergency. And then the final module, we'll put it all together. So that's basically what the modules are about. Now, the nuts and bolts, each module is an hour long. Each hour will be divided into 3 segments, 20 minutes long. And we will have 5 multiple choice questions after each segment to sort of emphasize the points that we're trying to get across. At the end of each module group, there'll be 4 e-tutorials to discuss the learning objectives from the previous lecture, and all the teaching will be in English in accordance to the UK best practice guidelines. Now, why is this important? I feel it doesn't matter what branch of dentistry you are in, a medical emergency can happen at any time. With patients living longer, having more complex medical problems, there is a greater risk that they're going to have a medical problem in the chair. And also patients who are paying large amounts for dental treatment have expectations. They have an expectation that if something happens to them, that they're going to be safe. And I think that's why it's very important that you're prepared. Just like the pilots, you know, they may not have an emergency landing, but they're prepared. They prepare every week to make sure that they put the priority of their passengers first. And as dental practitioners, we have the same priority, is that our patient safety must come first. So you need to be prepared. Now, what will you get out of it? Well, a lot. This is a method of getting a structured approach to managing any medical emergency, the basic knowledge and understanding of common medical problems, a step-by-step approach on how to approach an emergency, and most importantly for me, understanding how to recognize early and prevent medical emergencies. Remember, prevention is better than cardiac arrest. Of course, you will get a certificate in medical emergencies from a registered institution. And if you were planning to come and work in the UK as a dentist, you'll be examined on this thoroughly as a part of the ORE exam. And many people fail this part of the exam. The certificate will take you to a level required to pass the exam. And although having a certificate will not exempt you from the exam, it will put you in good stead to pass the exam. So, you know, don't delay, get your meds here. Thank you. I knew I was forgetting something. Now, it's important that you realize that this module is, well, this certificate is not a license to practice medicine. We cannot take any responsibility or liability for any errors that you know one may make in clinical practice as a result of attending this module, this course. And you must check with your regulators on best practice. And of course, you know, across the world, protocols, drug doses may vary, so you've got to be safe and actually check with your providers, your regulators, that you're using the correct doses. Now, if you go to www.dukes.com, you'll get all the information that you need, and you can always contact us if you have any queries. Thank you for your kind attention. Hello?
Duke's Dentistry et al. Proudly presents Certificate in Medical Emergencies for Dental Practitioners, together with Dr. ChetTrivedyMEDS. Hello, Dr. ChetTrivedyMEDS.
Good morning.
Would you be so friendly as to explain a little bit about the upcoming course and tell us some topics you want to talk about?
Certainly. Hi, my name is Dr. ChetTrivedyMEDS, and a big welcome to the Certificate in Medical Emergencies. Whatever field of dentistry you practice, there's always a possibility that one of your patients may become unwell and in the dental chair, and they will be relying upon you to provide them with life-saving treatment. Over the years, we've learned a lot about safety from the aviation industry. Flight staff spend a huge amount of their time practicing on simulators, looking at emergency procedures such as emergency landing during the flight, and this can make all the difference. Imagine you're going on holiday, and just as you've taken off, you hear one of the pilots say over the tannoy, "I hope we don't need to land this bird in a hurry. It's been a while since I've practiced an emergency landing. Enjoy your flight, folks." Our patients expect nothing different from us. They put their faith completely in our hands. They expect that if we become ill, they'll know what to do. Sorry, I got that completely wrong. Completely wrong.